Hi, good afternoon. My name is Katherine Perez, and today I'm going to be discussing cardiovascular disease risk, specifically in the target population of white adolescent girls ages 10 to 9 residing in rural West Virginia. So just to start off on the background of what cardiovascular diseases are, or CVD, essentially these are disorders that affect the heart and its blood vessels. This can range from coronary heart disease, hypertension, to stroke, rhythm disorders like arrhythmia, cardiomyopathy. There are several diseases that fall under this broad category of cardiovascular diseases. It is a leading cause of death for both men and women within the United States. Actually, a very serious health issue leading to over 800,000 deaths in the United States annually. It is a disease that is very prevalent among most racial and ethnic minority groups, and it has a significant cost. So it also has impacts on our economy, with it costing $363 billion annually, just from 2016 to 2017. And given the rise of inflation over the years, I can imagine that that has substantially increased as well. So now, just going briefly into the symptoms for cardiovascular diseases. This can range depending on the specific disease that an individual has, but symptoms can range from chest pain to palpitations, or even feeling like your pulse has slowed down significantly, numbness or pain in the extremities, sensitivity and swollen limbs, lightheadedness or dizziness, breathlessness, so that sensation of feeling out of air. Even for diseases such as a stroke, symptoms such as facial paralysis or even speech slurring is something that could also come up with this disease. So touching on risk factors, there are so many different social, behavioral, environmental, and biological risk factors for cardiovascular diseases. In particular, with the social and behavioral aspect, given how society functions, specifically with diet and exercise, that lack of physical activity, eating unhealthy foods, that can lead to developing diabetes, obesity, hypertension, high blood cholesterol. Those can all really significantly contribute to a diagnosis of a cardiovascular disease. Smoking is also another behavior that can frequently affect the heart and its blood vessels. In terms of the environment, there are several risk factors at play. There are various particles released into either the air or the water, just depending on the area that an individual lives. So the altitude that they're at could potentially play a role. Access to neighborhood green spaces, if there's limited access, could be a risk factor, because again, that can tie into that component of lack of physical activity, not able to breathe in healthy, clean air, and even proximity to roadways that can be very hazardous to an individual's health as well. In terms of biological or genetic factors, looking into family history, that is a very significant risk factor. Individuals who have a family history of cardiovascular disease or its associated risk factors do tend to have a higher prevalence of later on being diagnosed with the cardiovascular disease. I also included there mention of type 1 diabetes, since many individuals can also be born with that disease, versus type 2, which is usually brought on by some of the risk factors that we discussed here as well. So they're all very closely tied together. In particular, I would like to start delving into a little bit more of some specific contributing factors that I found in my research as I was looking into cardiovascular disease and selecting my population. So there are actually a lot of social and environmental factors at play here that either directly or indirectly contribute to the prevalence of cardiovascular diseases within a specific area, within a specific population. And some of those things that we might not always immediately think about, poverty, that can be tied to maybe that individual's living in a health desert, or a food desert, I apologize. And they don't have access to healthy, nutritious foods. They only have access to fast foods, or they can't afford to purchase fresh fruits and vegetables because the cost of living has risen so much in the last few years. A lack of education and specifically lack of knowledge on health literacy and health topics in general can also really significantly contribute to the prevalence of cardiovascular diseases. I've found through my research that it seems that a lot of individuals either have a lot of misconceptions about certain diseases, or they're not very familiar with the symptoms. And certain diseases, particularly cardiovascular diseases, may present symptoms differently in males versus females. And so that can cause a lot of confusion for individuals. And also, depending on the area that individuals are living, if they don't have access to insurance or to a primary healthcare provider, they might not have a medical provider who can provide them that information on a regular and ongoing basis. So that's definitely something that can contribute to cardiovascular disease. And again, that ties into limited healthcare access. If an individual doesn't have access to health insurance and they can't afford to go see a physician and address their health concerns, even if they are exhibiting certain risk factors, that can definitely be a detriment to their health and have a negative impact on their health outcomes. So as cardiovascular diseases evolve, if they are left untreated, they could potentially lead to additional complications. This can range from emotional difficulties, particularly if an individual is feeling a lot of stress, that, the increase in cortisol levels, that can create that sustained stress response, and that can definitely affect the heart and blood pressure, increasing that and leading to palpitations and those other kinds of symptoms. It can also lead again to speech problems, which I mentioned earlier. If an individual is experiencing a stroke and there's that blood clot in their brain, then it could be that they have some facial drooping on one side of their face, and maybe they have difficulty speaking or getting their words out as a result of that. And even paralysis, depending on the severity of the symptoms, if they're left untreated, if there are comorbidities such as diabetes, hypertension, that can really lead to a lot of other things like neuropathy and again, those swollen limbs that can all affect mobility and overall health. And of course, ultimately can lead to death with the worst of the complications. So now I'm going to get a little bit more into my specific population. So starting off, as I was doing my research, I found that there was a lot of information specifically on West Virginia, specifically the rural parts of West Virginia. If you'll note on this slide, specifically the counties highlighted in pink have a higher prevalence out of the entire state of West Virginia of cardiovascular disease in comparison to the entirety of the state. In the last several years, it's been consistently ranked as one of the least healthy states, particularly in regards to cardiovascular disease. And I believe in 2021, it had a prevalence rate of 14.6%. And it seems that every year that has been increasing, unfortunately. Specifically, when you get into the rural Appalachian areas, this area experiences what is known as a resource curse. So this is a very rural area where there is a lot of green space. However, there is also a lot of coal mining in this area. And so with the coal mining, that can be a bit of an issue, and it can add fine particles into the air and causing some issues. And again, that gets into that second point with natural resources such as coal polluting that environment and creating sort of hazardous environmental conditions that one wouldn't normally wouldn't normally hope for or think to expect in a more rural area, but depending on the specific types of minerals that are being harvested in that area, that can definitely play a significant role. In this table here, I'd like to show really the disparity that is experienced within the Central Appalachian region. So I found this table in my research as I was going through it. And if you'll notice, the middle column is the rate per 100,000 in Central Appalachia. And then on the right, it's being compared to the rate in the entirety of the US. And you'll notice that for basically every single health outcome, mortality in general, COPD, heart disease, lung and bronchus cancer, colorectal cancer, all cancer in general, it is found that they have a higher mortality rate across the board when compared to the entirety of the United States, which is a pretty significant concern. As you'll know at the bottom of the table, they also go into the demographic breakdown of that area and specifically of that region. So it does tend to have a slightly older population, and it in general has a predominantly white population. And in terms of the education and the poverty rates, the poverty rate is definitely higher in these kinds of rural areas, and that's a pretty prevalent trend that I've noticed throughout as I was looking through these different research articles. And in terms of the lack of health insurance, that seems to be a prevailing issue around the entire country. I would like to go a little bit further into some of those direct and indirect contributing factors, as well as the modifiable risk or protective factors. There's so much that goes into what can impact an individual's health. These are just a few that I did in my previous assignment of the health problem analysis worksheet. Specifically with this population, these are factors that are tailored specifically towards the West Virginian rural community. So in this area, individuals tend to have a lower median household income and higher rates of poverty and unemployment. There tends to be, again, that lack of access to healthcare services and providers, also lack of healthcare coverage. These are shortage areas that have been noted by other federal agencies, such as HRSA, for example. And again, health literacy and education, which I also touched on previously. In terms of some direct factors, again, that poor nutritional status, lack of access to fresh produce is a very big concern. If an individual is experiencing severe high levels of stress or chronic stress levels, that can play a significant role in how the body responds and how it adapts. And depending on an individual's biological or genetic makeup, those environmental factors could potentially influence the triggering of certain genes that could make it more likely to receive a diagnosis of cardiovascular disease later on. Other behaviors and factors that could contribute, in addition to smoking, alcohol consumption, again, increased BMI or obesity, poor diet, and even sleep management, which manages our circadian rhythm, is so crucial for heart health in general, and that lack of physical activity. All of those are major direct contributing factors. And that ties in very closely with the risk factors. That family history that I touched on previously, diabetes, high blood pressure, cholesterol, physical activity, unhealthy diet, all of those factors, when modified, obviously depending on the way that they're modified, may be able to influence those health outcomes related to cardiovascular disease. It could prevent it, or it could exacerbate symptoms and worsen those risk factors that contribute to the prevalence of the disease in certain populations. And I will be touching on the protective factors in a few slides, but I did just want to start touching on a couple of points here in terms of age and gender, and access to certain healthcare services could be potentially protective factors. And I'll delve a little bit more into detail with this specific population in a short moment. So now that I've given a little bit of an overview of the rural West Virginia population as a whole. I'd like to delve into my specific target population for the purpose of this assignment. I decided on white adolescent girls residing in rural West Virginia. And this was twofold. So the first reason is in my research, I've noticed that a lot of federal agencies and public health agencies specifically are really trying to support initiatives that are prioritizing early prevention strategies, early interventions with youth and adolescents, because there's a greater chance of addressing those risk factors at a younger age versus when someone is maybe in their 40s, 50s, or 60s. There is a better chance at that behavior change, and also it allows for less time to have had all of those symptoms. So typically the older one is, the more severe their symptoms may be. And that's something that has been a trend from what I've seen in the research. And also with this specific population, it seems that the state of West Virginia as a whole has had worsening health outcomes in several areas, even when it comes to youth and adolescents. Notably for youth and adolescents, they've had significant increases in the last couple of years regarding hypertension, diabetes, and obesity, which those are all major contributing risk factors that worsen the prevalence of CVD within this population. I did also want to note, because this is incredibly important, even though it's not necessarily applicable for my target population, BIPOC or Black, Indigenous, and people of color are disproportionately impacted by having a greater risk of complications or death from COVID, or I apologize, from cardiovascular disease. And so that is something that should definitely be noted, and there's definitely research lacking on those differences in terms of the effects on minority populations. But for the purpose of this assignment, because I did really find this very specific population, I did look into the US Census data, and it appears that for the most part, 91% of this West Virginia population is non-Hispanic white. And so for the purposes of this assignment, I chose to just tailor it to this specific population, because when looking at an intervention, I found with my personal experience with my job particularly, that tailoring an intervention to a specific population can make it more effective versus targeting a larger, broader group, or maybe several groups together, depending on the intervention. But that's just what I have noticed as I've gone through that. In terms of protective factors that I feel are very notable, getting into more specifics with this population. So this group, it's not necessarily that they are currently at risk for developing a cardiovascular disease at this moment, but they do have a severe risk of developing one of those diseases in adulthood. And I chose to focus on adolescence, which is that stage right before adulthood. So technically their young age would be considered a protective factor, because it does seem like there's a higher prevalence as an individual ages. I also included gender here as well, or sex, because it seems to have a lower prevalence overall in females versus males. However, for the state of West Virginia, I did notice going through the research that it appears to have a relatively similar prevalence across all genders. So that was pretty interesting to see. Access to a primary care physician is a major protective factor, which again ties into that health literacy component, that prevention and addressing risk factors before they worsen. All of those are really important in terms of protecting individuals from developing cardiovascular disease. So now touching on the relationship, I should say, between cardiovascular disease and COVID-19. So they are very closely related in terms of how likely you are to contract COVID-19 if you do have a diagnosis of some type of cardiovascular disease. Those with one of those diseases or just any of those risk factors are more likely to have worse clinical health outcomes if they do contract COVID-19. And it does have a greater impact, it seems, on their cardiovascular health overall. So they tend to have worse symptoms and higher mortality rates. And there's also a greater likelihood of having a comorbidity with cardiovascular disease. So that is also an extra layer of concern that individuals with that need to be aware of, because comorbidity of multiple diseases or risk factors can lead to an increase of symptoms. And so with COVID-19 added into the mix with that, that can really be very severe in terms of how it impacts that individual. And also worth mentioning is the fact that with my specific target population living in a rural area, there may be limited availability of vaccines, depending, on how many pharmacies there are in the area, that the specific views in that area on vaccination, whether there's significant hesitancy in that area. So all of that can play a role too, where if these individuals choose not to get vaccinated, then that could potentially also increase their risk and worsen the severity of those symptoms if they do contract COVID-19. Now, regarding specific interventions that are currently taking place within the state of West Virginia. So starting off, we have the West Virginia Cardiovascular Health Program. And before I get into that, I also do want to again preface this by saying that from most of the research that I have found so far on this topic, there has been a significant emphasis placed on early detection and prevention. So yes, it's obviously important to address existing symptoms and existing disease within older populations or adult populations. However, there do tend to be more successful outcomes with those early interventions, reduction of symptoms, reduction of those risk factors. And so that's why I found that worth mentioning. So now going into the West Virginia Cardiovascular Health Program. So the state of West Virginia actually has several various programs that are funded and supported to promote positive health outcomes, to reduce cardiovascular disease and its various risk factors and comorbidities. There are diabetes programs, there are physical activity programs. They really seem like they are doing their best to push these initiatives and advocate for better health outcomes for the people residing in their state. So it addresses, again, those multiple risk factors, and they're very comprehensive. They also try to address barriers like that limited healthcare access, which can also affect health outcomes. And then touching on the Million Hearts Initiative as well, that's more of a national initiative that is very prevalent within the state of West Virginia. And so they serve as a funder or collaborator with the West Virginia state government, and they support various initiatives and various targeted projects and programs for individuals. There's also a significant inclusion of community-based organizations, which I think is a great strategy in terms of building trust with communities, specifically this rural population that we're talking about right now. That is really important to build trust in the research that is being done, the interventions that are being done, and it helps build up that rapport with the community and hopefully get more individuals to sign up for those interventions and to follow them through. In particular, I did want to touch on these targeted interventions. As I mentioned previously, I do think that there is significant value in tailoring into individual interventions for specific populations, just because you can isolate specific behaviors or specific risk factors and address those one at a time, or an initiative or an intervention can be culturally or linguistically tailored for the specific population. For example, if I was talking about a Hispanic population here, I would hope that I would have found significant research on programs that were translated into Spanish and that took those cultural considerations into account in terms of the actual intervention itself, to minimize stigma and actually have an effective outcome with the population. So in terms of my proposed communication strategies, I had a few. The main one that I selected is a tailored social media intervention. I've actually worked with this with my job currently at FIU, and I have found it really interesting how social media can serve as a very effective prevention strategy, particularly with youth and adolescents. I think that if the communications are very specifically tailored to a population, maybe by conducting focus groups, interviewing key stakeholders prior to starting an intervention. I believe wholeheartedly that all of that needs to be planned out very thoroughly, and that an intervention should never be developed without the input of the individuals who are part of that population. So I think that that's something that could significantly impact the effectiveness of these programs. And targeted prevention efforts on social media, even just risk reduction posts across various platforms, reaching this younger population. It could be TikTok, Instagram, Twitter, Facebook. There are so many different platforms, which offers a lot of flexibility and I think offers a broader reach than potentially handing out flyers. But again, it depends on the area. Every rural area and every community is different. And so for that reason, I've also thought about supplemental communication channels or platforms in a rural area, depending on whether there is any difficulty with connection to internet or Wi-Fi. Perhaps a social media intervention may not be the most effective thing. And so I did want to touch on other ways to reach out to this community, propose a new intervention. I personally think that in-person community outreach is really important. And again, that builds trust with that community. I also think maybe even small things like television or radio advertisements could significantly bring people in and get them interested in some type of program. Maybe even some sort of incentivization, some sort of promotional giveaways. Personally, I've worked on a project before. We were working with young adults with this particular population, but we used to give away items like t-shirts and pop sockets and little things like that, it would incentivize students to participate in our intervention, even if it's in some small way, but it still overall seemed to have an effective impact within that community. And so that was something that I think could be translated into this type of intervention where, especially working with younger kids or adolescents, that's that age where maybe they don't want to do everything that they're told and eat healthier and things like that. So maybe they might need a little bit of motivation. And there is understandably a fine line with incentivization for research, where you have to make sure that it's ethical and that it's not too much to the point where it becomes a gray line, where people are coerced because of the incentive involved. So that's always something to consider and things like that. And also, I really do think too, school-based interventions would be really effective for this type of population. I am of the belief, and the research that I've gone through seems to support this, that multi-faceted or comprehensive interventions tend to be more effective because they're targeting more than one area at once. So for example, if there was an intervention done in the schools, that would allow researchers or practitioners, whoever is particularly involved in this project or in this intervention, they would be able to involve parents, teachers, and the adolescents who are the target population. And it may have a better impact or a more significant impact than just speaking to the adolescents alone. Parents especially tend to have, at that age, greater control over their children's diet, their activities. So that's something that it can, again, touch on multiple different approaches and be very comprehensive in how it can be addressed to minimize those risk factors in these adolescents so that they don't develop cardiovascular diseases when they do become an adult. So I did want to share this table here. So I thought that this was really interesting and worthwhile in terms of mentioning a specific intervention and a specific program and ways to communicate. I do believe that clarity of goals is very important, and that's something, again, that should be established from the beginning of an intervention. I wholeheartedly believe, again, in incorporating all those key stakeholders in doing key informant interviews or focus groups with this specific population to get their feedback and their input on how the intervention can be tailored so that it's more effective. And this particularly was from the diabetes plan that West Virginia developed in 2021. So essentially, as you can see, they specified various activities for this intervention. And the goal here was to create community environments that encourage healthy eating or healthy living, I apologize. And so these activities are very clearly outlined. There's a designated entity responsible for managing that activity and conducting that activity. And then there are short-term goals specified and a strategy for evaluation, which is crucial to actually determine whether the intervention is effective or not with this population. So looking at that and again, getting a whole comprehensive idea of how the intervention will go from beginning to end, I think is crucial with something like this, especially because influencing behavior change can be very difficult. And so I feel like researchers and clinicians really try to do their best to cover their bases with these areas just to make sure that they are having an effect on the populations that they're working with because they want to make a positive change. But it's very difficult to do that when there are no clear goals outlined, when there's not a plan of evaluation, when the intervention itself is not based in evidence or in best practices, if it's not culturally or linguistically tailored. All of those components are really crucial in terms of getting an effective result. So in conclusion, I do want to again reemphasize the fact that cardiovascular diseases are a significant and very serious public health issue that we're going through right now. It results in 1 death every 36 seconds in the United States, which is jarring to think that it's that many. And the prevalence specifically in West Virginia is very concerningly high in those rural areas in the Appalachian region. So it does seem like specific interventions that are focused more on prevention may be beneficial for them, particularly to minimize the prevalence of those risk factors in youth and adolescents so that they don't develop cardiovascular disease as they develop into adulthood. So thank you very much for taking the time to listen to my presentation, and I hope you have a wonderful evening.